We don't know what is first, chicken or egg.
Your body is only thinking about surviving the next 5 or 10 minutes. It's not thinking about reproduction and healing and regeneration and all of those things. It's just in survival mode.
So we actually losing the ability to think.
You say we have bigger brains and we're not using them right.
We're not using them right. That's exactly what's happening.
And you know it's not genetic because when the orthodontists move the teeth to where they think they should be, where do the teeth go when you don't wear your retainer?
That field kind of covers the whole anthropology and evolvement of human beings.
The fact that they're chewing on much harder foods, I think stimulates that development.
I remember from dental school, I had one of the patients who had almost no teeth left.
Adrenaline, your blood sugar goes up, and now you're laying in bed. You're supposed to run or fight.
So they use ozone to disinfect the water supplies.
You're chewing on both sides. Now we're eating such soft foods that we turn into two-sided chewers, and we're not creating that strain.
Dentistry is kind of a separate corner in this whole medical field.
Welcome to the Ask the Dentist podcast with Dr. Olga Dolghier, where your smile meets your overall health.
Okay, welcome to Ask the Dentist podcast. I'm here with you, Dr. Olga Dolghier. This podcast was created to find the best information and meet different dentists and medical professionals and talk about different fields. Today, I have a special guest. His name is Dr. Ingo Mahn. He is integrative dentistry specialist. So his profession is dentist, but he also specializes in his practices focused on airways and integrative medicine.
Correct.
So Dr. Ingo, welcome.
Thank you.
Thank you for joining us.
Yeah, thanks for having me on.
Yeah, absolutely. Yeah, when I was researching your topics and I ran into integrative medicine field, and I wanted to ask you, since you've been practicing for quite a long time, right?
40 years.
40 years.
Yes.
Wow.
I just had my 40-year reunion from dental school.
That's amazing. That's amazing. And that's a good example for a future professional that you stayed in this profession for a long time and still practicing.
I've had a very interesting career.
You did? Yes. Okay.
A lot of changes in 40 years.
So that's what I wanted to ask you. Since you've been in this field for so long, tell us how dentistry evolved during those 40 years.
Well, I think we all go to dental school and get trained in a very conventional way by people that have probably graduated 50 years before us, and people always think, oh, you know the latest when you come out of dental school, and you realize that you know actually very little when you graduate from dental school. And I always liked learning new things and using the latest materials and equipment. I come from a family of German engineers, and so I was always one of the early adopters. I got into the CEREC, the CAD/CAM technology, where you make the crowns and the restorations in one visit back in 1995.
Oh, wow.
Before, when it had said Siemens on the machine.
Yes, it was the first ones. Yeah.
And then I got into the cosmetic. I really enjoyed doing that. And that's when I started going kind of more metal free.
Gotcha.
And I got into that more for the aesthetics and the physical properties, not so much for the health reasons. But what ended up happening is that I got this reputation that, hey, Dr. Mahn will take out these fillings for you, do a good job, and replace them take out the mercury and the metallic fillings. And so all of a sudden these patients were coming in and bringing me pamphlets for Dr. Huggins and the IOMT, and I'm looking at all of this going, this actually makes a lot of sense. And once you open that door and you learn about it, I don't think you can, it's one of those things you can't unsee.
Yeah.
And I really felt like I was really helping the patients a lot by the kind of dentistry we're doing. And then once I got into dentistry, into airway dentistry, that was even more profound, because now when you help people breathe and sleep better, you're making changes very, very quickly. People come back in 2 or 3 weeks and say, oh my gosh, you've changed my life with what we're doing here. So it's been very exciting to go through all of these different transitions.
The whole field of dentistry, I feel like I learned more after dental school. A completely different fields, different areas, which we technically cover very briefly in dental school, especially in integrative medicine. It's such a hot new topic.
Yeah. And back in 2000, once I got into the holistic dentistry, back in 2003 and 2004, I actually went and did a 2-year integrative medicine program out in Georgetown at Capital University.
I saw that on your resume.
Yeah.
Tell me a little bit more about it, because I wanted to look into integrative dentistry, but there's no integrative dentistry.
Yeah.
There's integrative medicine.
Correct.
So how long is that program?
It was, unfortunately, the university isn't around anymore. It was a phenomenal program. It was just once a month. You would fly out there for a long weekend, and it was very intense. But I did it more because I wanted to be able to communicate better with my patients, and I wanted to be able to communicate with the practitioners that were referring to me. And it gave me a much better understanding of, people coming in and talking about craniosacral and, applied kinesiology and all of these things that they certainly don't, teach us about that in dental school.
Yes, that's a whole different world.
And so it's a great way to make a connection with patients, because when they started talking about some technique that they thought I was going to roll my eyes, at them for,
and what
I actually knew about it, and they were like, "Oh my gosh, you're," and they felt like they were in the right place and in a safe place where they were with someone who was on the same page with them.
Very interesting. Also, that field kind of covers the whole anthropology and evolvement of human beings, right? Integrative medicine in general. Because when I looked at your book, let's talk a little bit about your book. It was interesting because when I was searching about the integrative medicine, about Dr. Pierce, right? Dr. Price.
Dr. Price.
Western Price. And I heard his name multiple times through different sources. And I saw the name in your book. So I kind of started to tell me about this whole anthropological aspect.
Well, Dr. Price was an interesting doctor. He was actually an American Dental Association doctor. He was the most decorated researcher for the American Dental Association. And he started in the 20s and 30s. He went to these, quote unquote, primitive societies.
Yes.
And he showed they had these fully developed jaws and beautiful teeth. There were no dentists and no scope and no toothbrushes around. Yet these people had these beautifully developed faces and mouths. And he also showed that as we introduced refined foods and refined sugars, that they very rapidly deteriorated. So that was his big book, the Nutrition and Physical Degeneration is the name of his book. And then he also started studying things about root canals. And when he started talking about root canals and how they could be very problematic, that did not go over very well with the American Dental Association or the American Association of Endodontists, and they very quickly kind of blackballed him and really ostracized him. But he was a very meticulous researcher, and he showed that there were all kinds of problems.
It's very interesting anthropologically, because I remember I wanted to join Operation Smile at a certain point because I like volunteer work. And I met anesthesiologist who actually does Operation Smiles with cleft lip and palate. And she was telling me about different countries, how actually what they eat affect their structures. And she was telling me a story when they went to Africa in one of those primitive tribes to fix cleft and palates and those societies in need. One of the dentists came with them, and they had nothing to do technically. There was no decay. There was no malocclusion.
Well, it's really interesting. When I first transitioned my practice from conventional dentistry to holistic, I used to do a periodontal treatment plan for almost every patient. It would always be a restorative treatment plan and then a treatment plan to fix their gum disease. Anything from mild periodontitis to full-blown bone loss. And all of a sudden, I'm seeing these holistic patients, and I'm not doing the gum treatment anymore.
So they don't have gum issues as much.
And so I started asking them. I said, "Well, how often do you brush?" And people go, "I don't know, twice a day." "How often do you floss?" The usual answer, "Not as often as I should," which could mean anything. And I really got it down to the only difference was the diet of the patients.
Wow.
So that was the only difference, because their oral hygiene wasn't really any different from the conventional patients.
That sounds like now diet, we're all talking about diet and different type of foods. So nutrition is the key, right?
And not just because this kind of leads into the airway part of the puzzle. When we think about food and nutrition, we think about the nutritional quality of foods, but we don't always think about the consistency of foods. And, prehistoric man had a diet that had the consistency of beef jerky. So we were chewing on very hard foods, and we were creating all of the strain in our jaws that was promoting the growth. And now you're in a society where, moms are being told that breastfeeding is, that bottle feeding is just as good as breastfeeding. We're cooking our foods, we're microwaving. So we're eating these very soft diets. And that's really what's creating a lot of these problems with these underdeveloped airways, which leads to sleep problems and all kinds of health problems.
Almost sounds like we're evolving in the wrong way.
Maybe I was going to say devolving.
Devolving.
Yes.
Because airways becoming smaller and smaller, right? Our cranium becoming bigger. And I heard about that effect of social media actually on the brain, that visual cortex becoming bigger.
Yes.
So we actually losing the ability to think, but we see
I was going to say, we have bigger brains and we're not using them right.
We're not using them right. That's exactly what's happening. Yeah. So talk about nutrition. What's the difference? What do you see? What type of diet those patients who don't have periodontal disease eat?
Well, I think it was mainly they were eating more whole foods. So they were eating, more fruits, vegetable meats, and things like that versus, like canned food and refined sugars and potato chips and, Twizzlers. So they were really limiting the number of carbohydrates that they were, refined sugars that they were eating. So that seemed to be the biggest difference.
Was it more like whole foods in terms of meats, heavily on meats and less just refined sugars, or is it more carbohydrates versus fats versus protein?
I think even if, I'm not a big fan of like a vegan or vegetarian diet. I think it's very important to have a certain amount of good quality protein. But I think it's just even, just eating foods that, the joke is kind of like anything that doesn't have writing on it.
Yeah, that's right. That's right. Not that's what I teach my patients, young moms, when I say, okay, buy everything what is not in pre-bag containers.
Yeah, exactly.
If it's not bag, if you made it at home, that's good for your child.
Yes.
Homemade foods. Plus, now it sounds like more and more studies coming out about ketones, right? So more you can get ketones from good fats, right? And well-balanced proteins, because essential acids you cannot.
I know, and those are the things that it's almost everything that we're being told. I told my son, I said, if you learn nothing else from your dad, I said, just do the opposite of what they tell you, and you have a 95% chance of being right. If they tell you to eat margarine, eat butter. If they tell you to eat the egg whites, eat the yolks. If they tell you to stay out of the sun, go outside and get a little sunshine. And really, we're being so misinformed, and I actually feel badly for these people that are getting this misinformation, and they really almost don't have a chance of being healthy.
How about vitamins? So because nowadays it sounds like we're scared of sun. I'm glad you brought it up, because in dental school we kind of touch up on rickets a little bit, right? What rickets are. But there's like an extreme of vitamin D deficiency. And we don't really talk about K2, B complex vitamins.
Yeah.
What is your input about this?
Well, I think, obviously I think our food supply has been really compromised. And so even if you're getting organic food, you don't know, they could take that orange in Florida, throw it into a semi-trailer, spray ethylene oxide in there, which is one of the things that promotes ripening. And this orange ripens in a semi-truck on the way from Florida to wherever it's going. I mean, that orange is not going to have the same nutritional value as, and even if it's organic, you go to the store. I just traveled to Europe for the first time in a while, and I went to this farmer's market, and I just want to go back and live in Europe just because of those farmers markets. I'm smelling the food. Like you walk up to strawberry, you smell it, and here and then you go to Whole Foods here afterwards, and you're like, this food looks horrible compared to what we're seeing in other countries. So I think it's very, very difficult to get good nutrition. So I think you do have to supplement to a certain degree, just because you really don't know. I mean, we can't test every piece of food we buy from the store, so we don't know what we're getting.
Yeah, talking about, I'm from Europe as well, from Eastern Europe. So when we visit my husband's family, they live on the farm. So cucumbers, I cannot find like the same tasting cucumbers anywhere else. And tomatoes, it's just amazing kind of sweet taste to them.
And they smell.
Strawberries,
Like, as you bring it to your face, you can already smell the food, which is so amazing.
Yeah, it's amazing. I hope it changes, because now public, and I hope our government, everybody becoming more and more aware that it was very detrimental for the society.
You might be more optimistic than me, because I think ultimately it's still the corporations that are, looking. I'm all for making profit and I mean, that's what drives their society. But I think there's so much greed where they're willing to say, we don't care what the nutritional value is, the more money we can make off of this.
That's so sad.
It's unfortunate. You almost have to, that's kind of the bad thing about living in Arizona, even in Wisconsin, where I practiced many years in Wisconsin. And it's kind of hard to grow things there. I would love to live somewhere. I've had some patients move to Tennessee. I go, oh my God, that would be the perfect place to live, where you could have this big garden and grow your own vegetables almost year round. I go, that would be amazing. I think that's almost what you have to do, is have a little greenhouse and grow your own
that's
stuff.
not a bad idea. Not a bad idea. So nutrition is the key. Sounds like it. What about the airways? Something you do heavily in your practice, my understanding and this is, I think it's such a valuable field, because we see airways. I'm on the pediatric side. We see these issues very early, and there is a common belief there is not much we can do about it. But then if through the life, this person, which we see as a child, progress, and then they are suffering more and more and more. And at a certain point, we're reaching the sleep apnea. And then CPAP machine, it sounds like the only option and traditional approach. Tell us more. What do you know about airways in dental field?
Well, it starts in the womb and how baby is born. And then, of course, the big thing is the breastfeeding. There was an article it was the journal Functional Orthodontics back in 2001 that showed that the real benefit of breastfeeding is the actual physical act of breastfeeding. And I kind of joke with my patients, I would rather see a baby drink formula out of a mother's breast than mother's milk out of a bottle, because that early functional orthopedics that's happening with the jaw literally forms the foundation of our health for the rest of our life. So when those structures are underdeveloped from birth on, that's something that's really hard to recover from. Now, fortunately, we're using an appliance that's an epigenetic appliance that still allows us to re-express our DNA more optimally. So, for people who aren't familiar with epigenetics, we have our genetic blueprint, but how that is expressed is dependent on our environment and nutrition. And so it's something that can still be reversed, but it's very difficult. So that early, chewing on firm foods, breastfeeding, that really is where it all starts.
For sure.
A lot of these, when you start studying this, when I started doing Airway, I noticed that these were not problems that developed in these patients when they were 40 or 50 years old. They started telling me stories
from the beginning.
All the way, and all the ADHD and behavioral problems. When we treat children for Airway, oh my God, parents come back and they say, I have a different child.
Wow.
How can you expect a child to not breathe well at night, literally be fighting for their breath all night, and then expect to sit at a desk in the morning and learn math? I mean, it's just not going to happen. And then what do? They label them and give them medication, which probably makes the sleeping problem even worse. And it really puts kids in a tough position, because they're growing up in an environment that's where the deck is really stacked against them, especially like you mentioned. Now they also have this poor posture where their head is down, and we used to, at least as kids, we got to run around outside and get some sunshine and play ball with our friends. And now they're doing it on a
and it's so addictive. Kids cannot to stop doing it. So airways. So you think that we can catch it early and as young as young 1-year-old, 2-year-old, and start working on it to improve the airway to set them up for a successful life?
Yeah, and that's where really we have to use that team approach, because I think it's hard to be. It's hard to learn about all these things. Every time I tell my patients, the more I learn, the dumber I feel, because every time I learn something new, I go, oh my gosh, there's a whole bunch of questions I didn't even know I had.
I know.
So I try to always partner with people that are already, where that's already their passion. So in our practice, we have someone, she's a speech language pathologist and a myofunctional therapist.
Mm-hmm.
And so all of the children get evaluated by her first, because there's some great systems like Healthy Start and MyoBrace and Tooth
I
Pillow.
heard about those.
But they're not always necessarily the best. You know, some kids, if they have a tongue thrust habit, they have a very difficult time with those appliances, and they can actually, and also compliance. You know, getting a 4-year-old to wear this piece of plastic in their mouth is, some kids are great, but most of them aren't. So if we can give them some fun exercises and do some things to at least start that developmental process, that gets them off at least on a better path.
Myofunctional therapy, it seems like it's a new field emerging. Because I when I started to learn about tongue ties and airways, that was something completely new and was not touched up in dental school.
No, not at all.
Not at all.
And they don't, they say we don't even know why, kids have these tongue ties. I know at least some pediatricians are looking at those.
I see more and more pediatricians actually aware of it, because
especially I think moms want to know about breastfeeding, and if children have a hard time latching on, a lot of times the tongue tie is the main reason for that. For sure.
In our practice, we actually have a lactation consultant who is we work closely with chiropractors. So we have this integrative approach for infants. But for children, when I run into these new appliances, I still have a little bit of hesitation, because like you said, there is a tool, but implementation is the key.
Yeah.
And sometimes if we run into, there is a very receptive mothers and children, but sometimes children, if they're not compliant, that's a big issue.
Yeah.
Like, how do you make?
And I'm looking at an appliance. It has been around for a while. It's called the Alpha appliance.
I heard about that. Yeah.
And it's what I like about it is it's very similar to the oral appliance that I use on adults, in that it's not a brute force appliance like a palatal expander where you're turning the screw and physically pushing. It's light cyclical forces, and that's what our body responds to. It's the chewing, the swallowing, the talking, walking. All those things are light on-off forces, and that's what stimulates our body to grow. And that's the same thing with this light wire appliance. It's not something. It's something that can be placed permanently in the mouth, so compliance isn't as much of an issue.
Do you see like a suture expansion with it, or no, or just a tilting?
So that one, I'm just getting into and just learning about that, because the more airway I do in adults, the more it makes me. And of course, those parents come in and say, "Hey, I have a child. Can you help?" I'm seeing what it's doing for me. I don't want my child to have to go through 30 years of suffering through health problems before someone finally figures out that it's related to their breathing and sleeping.
But a lot of times what I feel the controversy about it, because we can fix certain things, but could be, we don't know what is first, chicken or egg, right? Because the lymphatic tissue of the mouth and nose and throat, it's actually naturally supposed to be enlarged until certain age, and then lymphatic tissue kind of descending, and at that time we're also forming our airways and the palate and everything. And I see the value of placing some type of lines, because some kids, like you said, genetically already crowded from day one. Like a couple of teeth came in, and instead of nice gaps, mom's always concerned about gaps, but gaps is a good thing.
Lucky.
You're lucky to have gaps. But sometimes you see a 1-year-old and mom is trying her best, she's nursing, but when I'm looking at the dad and mom, they both have kind of long faces, dolichocephalic appearance. So the poor kid already inheriting this.
I still don't always think of it as genetics. They probably were also in a situation where their DNA didn't get fully developed. So I tend to always think that if you give the right environmental condition, that we have the DNA blueprint and for a more fully developed jaw. And I think that's the kind of almost like the cop-out that orthodontists use. It's like, well, that's just your genetics.
Yes.
I always look at it, to me, it's always a muscle problem. When I see crowded teeth, that means that the tongue, the tongue is like a little orthodontist.
It's a biggest muscle.
It's a big orthodontist actually in there. And every time you swallow, the tongue is supposed to go to the roof of the mouth and push out. Well, if you have a tongue tie or that tongue is under functioning, you start engaging the muscles of the lips and cheeks, and you develop that abnormal swallow pattern. Well, now everything is pushing in, and the tongue's not pushing out. Where are the teeth going to go? And you know it's not genetic because when the orthodontists move the teeth to where they think they should be, where do the teeth go when you don't wear your retainer? You know, the teeth
go
don't.
back.
Yeah, the teeth don't move back because they go, well, genetics said we should be here. It's they go back because the muscles are pushing them. So to me, it's always the teeth are where they are because that's where I'm looking at what are the muscles doing to put the teeth where they are. And so when I see crowding, to me, I'm always thinking about how do I fix the muscles first, maybe create a little bit more space with something like the homeo block, and then go in and follow up with some orthodontic treatment to do alignment at the end. But now you've got more space, you've got better muscle function, and so now you get a much better and more stable result.
Very interesting. In our field, like in my, because I see different populations technically. So I notice sometimes tongue tie, I definitely can see relationship between high palate and severe tongue tie, but sometimes I don't. Sometimes I see
mouth breathing is definitely will lead to one of those vaulted
for
palate
sure,
as well.
For sure. But sometimes we see, and I personally see in the practice because I believe in tongue tie, and I think it does play a role. But a lot of times we see kids with origin from, for example, I know Hispanic origin from Mexico, for example, and they have the widest jaws, and some of them have full tongue tie. And I'm like, how are you living? How are you compensating?
I've noticed the same thing, especially where we practice close to the border. You know, if I get someone that's Mexican, I go, did you grow up here or did you grow up in Mexico? And I know what the answer is going to be. And I think their diet, I think when they're children, I think they're eating a much, much firmer diet than if they're raised here in the United States. So I think even though maybe they have the tongue tie, the fact that they're chewing on much harder foods, I think stimulates that development.
Yeah, but sometimes you see opposite. You see, for example, a no tongue tie, right, at all.
Yeah.
And then the highest palate ever, and they have the sleep apnea and everything else.
And I think when you get into sleep and airway, you realize there's so many contributing factors.
A lot.
There could be allergies. There could, and I'm not completely discounting genetics. I think that does play. It just seems like everybody goes right to genetics, and I just noticed, like, wait a minute, there's
for sure. I think there is a very big contributory factors because we know, and even in dental school, we do cover adenoid phase. Remember they say adenoid phase. I remember it from dental school. I was like, okay, you are adenoid phase because you're mouth breathers. Yeah. And now I think that group of kids or adults in the future definitely deserve more attention than just mechanical expansion.
Yeah. And that's what we kind of do in our airway program. We start the oral appliance that we do. I kind of call it the low-hanging fruit. We're kind of creating strain with it. We're stimulating growth of the maxilla. We're promoting proper tongue position so the tongue has to lift. It's a uniblock appliance that's higher on one side, which is really weird for dentists. We like everything to be balanced.
We learn parallel.
But you think about when you chew beef jerky, you're chewing on both sides. Now we're eating such soft foods that we've turned into two-sided chewers, and we're not creating that strain, that big sphenoid bone that almost all the other cranial bones are attached to. When you torque that bone, you allow the cranial bones to move. You stimulate the growth of those structures, and so that's one of the things the appliance does. It creates the strain to stimulate the growth. That block also forces you to lift your tongue an extra 4 or 5 millimeters. So you're kind of, Dr. Balfour, who invented the homeo block, said it's like taking your tongue to the gym. And then it also downregulates the autonomic nervous system because it stimulates the vagus nerve. And so it's really interesting what that appliance is able to do to get people, to kind of replace some of the things that we're missing in modern society. So I call that the low-hanging fruit. Like, okay, let's tone the muscles that dilate the airway. Let's create more space, and let's calm the autonomic nervous system down. Because when our patients are in that sympathetic fight or flight mode, your body's only thinking about surviving the next 5 or 10 minutes. It's not thinking about reproduction and healing and regeneration and all of those things. It's just in survival mode.
And in our society, we see it more and more and more. We see these grinders, we see kids. And
Yeah.
especially, I mean, I remember from dental school, I had one of the patients who had almost no teeth left. Like everything was grinded down to
And that's,
to the
you
gum.
know, the research now is showing that, you know, they told us, I mean, I used to spend so much time equilibrating bites and all these different things. They're showing that it's almost all, that it's a protective mechanism, that clenching and grinding helps keep the airway open. And it has actually very little to do with stress or bite issues, because it's certainly not a bite issue, because when you look at what our patients do to their night guards, their teeth aren't touching and they're still grinding like crazy because we're probably taking up more room with that night guard. You know, we're probably pushing that tongue.
Probably, that's a good point. Actually, you positioning of the tongue. So when you do your airway assessment, for example, what are you guys focusing on?
So we look at, again, we try to look at the whole picture. We use a large field of view cone beam scan. I don't just look at the minimum cross section of the airway, kind of like what's the narrowest part of that tube going to the lungs, but I look at the shape of the airway. You know, you want to see a fairly nice round airway. You see a lot of people, they have these flat airways, and I call that the fire hose, because as soon as they lay down, it takes very little to compress
Closes
that.
down more.
Excuse me. You know, we look at their sinuses, we look at other tissues, we look at their turbinates. So the cone beam is not necessarily the most important part of the puzzle, but I always kind of joke that you have to play Sherlock Holmes when you're treating airway problems, because there's so many different contributing sources. We do a home sleep test. And it's called sleep image. You just put it's a very simple device that is very easy for patients to do. And then we have a form called the impaired mouth assessment. Probably if I just sat down with a patient and I looked at this impaired mouth assessment, and we look at things like, are there tori, scalloped tongue, vaulted palate, crowded teeth, all of those different signs, and then look at, how do you feel in the morning? How often do you get up at night to go to the bathroom? Do you dream? Do you have neck and back pain? So there's a whole little, if I just had that form and sat down with the patient for 5 minutes, I wouldn't need x-rays or sleep studies or anything. The cool thing is, when I see that, when I get their sleep study, I go, oh, I know exactly what their sleep study is going to look like. And it's always right on. So you can just from talk, you do enough of these, you pretty much get the feeling. And the people that end up in front of me, of course, all suffer from very similar things. So there's definitely a pattern to people who are suffering from airway issues.
So our audience, probably there's a lot of moms who probably have snoring husband and different age groups. So if we have a patient who has history of snoring, I know about adipose tissue, right? So adipose tissue kind of deposits in upper body, and then it creates restrictions of airways. So
we always think of fat going out, but you forget that it also pushes in.
Yeah,
and
because
pushes
visceral fat, right?
Yeah.
Visceral fat, and nowadays I think they do DEXA scan just for to determine where your fat is. Is it good fat, which is on the adipose tissue, or is it visceral fat? So if you get an overweight patient, right? Because the adipose tissue play a huge role. And because we get a lot of questions from, sometimes when I do tongue ties on baby, or little child, I might ask some questions about snoring and so on. It's part of my questionnaire. And a lot of moms pointing on the husband. He snores. He snores. So tell me, if you got this, for example, younger guy with a little bit of adipose tissue, but definitely a significant snoring issue, where do you start? After all this assessment, what is the treatment? How do you fix that?
Well, weight is kind of an interesting thing, because everybody kind of thinks that, oh, you're overweight, so as a result, your sleep
That's a common
is bad.
Belief, right?
It's actually, in most cases, the opposite. Poor sleep, there's probably 4 different mechanisms that can cause weight gain from poor sleep. So one would be, it affects leptin and ghrelin, which is the appetite suppressing and stimulating hormones. It affects cortisol levels, because when you have that resistance to airflow, your cortisol goes up, your adrenals are releasing that adrenaline, your blood sugar goes up, and now you're laying in bed. You're supposed to run or fight, and instead you're laying in bed trying to fall back asleep. So now that blood sugar gets converted into fat. There's there's also, they've done studies on showing that it affects eating habits. So a poor night's sleep makes you make poorer food choices. And then finally, even the balance of CO2 can make you gain weight. It wouldn't be fat, but it would make you gain weight. And it's obviously very discouraging when you go to bed at night and you wake up in the morning and you get on the scale and you're a pound heavier and you're like, wait a minute, all I did was sleep all night. I should have lost some weight.
Could be water retention, right?
You could
water retention.
Yeah. The CO2 and water. That's exactly it. And so of course then, that makes you gain more weight, which makes your sleep worse. So it is this
like
vicious
a pathological vicious cycle.
Yeah. And so we have a lot of, because men are generally easier to diagnose because they tend to, there's a hormonal protective mechanism against airway collapse in women. And so women are grossly underdiagnosed. Like everybody kind of looks for the overweight guy with a little thicker neck in the middle.
Yes.
I mean, that's kind of like, you don't have to even guess.
That's your classic example.
But women are underdiagnosed because they tend to have smaller events. And the events aren't long enough to register as an apneic event, because everybody looks at the AHI, which is the apnea hypopnea index. So how many times an hour do you stop breathing for 10 seconds or more, or does your blood oxygen drop by 3% or more? So women don't tend to have severe enough events to register as an apneic event. So they know they sleep terrible, they know they feel horrible, but they have a sleep study done and they go, oh, you're normal. But if you look at the respiratory disturbances and you look at their sleep quality, it's really poor. So they suffer from something called upper airway resistance syndrome. And any resistance to airflow puts your body into that fight or flight. So all night long, they're in this fight or flight, but from a medical standpoint, they're fine because they're not, there are AHIs to a point where they're covered by insurance and they're qualified for CPAP.
Oh, I see.
So women
because
really,
the treatment is CPAP, right?
Yeah, they suffer from this. Their sleep quality is poor. You look at the number of anxiety medications that are prescribed in this country. They never get into the proper level of deep sleep, which causes body pain. And we get patients with fibromyalgia and all these different symptoms. They start getting anxiety and depression and all these things. That a lot of times goes back to not getting enough REM sleep because they're having these little minor sleep disturbances all night long that the medical profession doesn't even really know to look for.
Interesting. And so in this case, how do you treat this? What is the approach?
Well, we do from the sleep study. Those are the things I look at. I don't just look at. I tell my patients, when your apnea, when you're getting to that AHI, when that starts going up, that's the end of the road. Your body will do everything to keep you breathing. Our bodies are intelligent. It knows that oxygen is the high priority. So it'll do whatever it takes to keep breathing. And so the nice thing is we have an appliance that is able to treat the contributing factors to sleep apnea. So you don't have to get to that endpoint where your body is now actually not breathing. I'm looking at what's your body doing to keep you breathing, like the respiratory disturbances. And the cool thing is with our appliance, we can help tone the tongue. We can downregulate the autonomic nervous system. So anybody could wear that appliance and benefit from it. You don't have to have a diagnosis of sleep apnea, which also makes it nice because we don't have to work with sleep physicians. I can just look at the sleep study and go, oh, I see what's going on. But because we're not, and unfortunately, it's a cutting edge appliance that we don't have any insurance coverage for it. And it's really to get insurance coverage, you need to have that diagnosis of sleep apnea. So I can just look at their sleep study and say, yeah, there's some problems here and this is what we need to do. And we can move forward with treatment.
And what type of appliance is that?
So the appliance is, it looks like an upper retainer.
Okay.
And the nice thing is you put it in at night when you go to bed and you take it out in the morning. And it has the little block that's a little higher on one side.
Yeah, that's what you're saying.
I decided to make one of these for myself because I have a gag reflex. I don't like things in my mouth. And I wanted to see, okay, what am I asking my poor patient? I always like to try things on myself. If I can.
I love to do that too. Yeah, completely understand that. Yeah.
It's easier to have conversations with people if you go, well, I've done this and this is kind of what you have to look out for. And I put this appliance in and I went, not only is it not bad, I'm actually really liking how this feels. I could just feel my system calm down. And I was wearing an Oura ring. And I was only getting maybe 15 minutes of deep sleep. Now, that being said, I found that the data from Oura Rings and some of these sleep
apps
monitors are not as accurate as, because sometimes I would wear 3 or 4 different ones, and they were all over the place.
That's a good way to check.
But you can use it as a baseline. And so the first night I wore my appliance, I went from 15 minutes of deep sleep to an hour and a half.
Okay.
And I consistently had.
So what appliance would you recommend? Because a lot of people wearing those Oura Rings as a guideline, like how the sleep is.
I don't.
There is no.
I don't know enough about the accuracy.
Gotcha.
You would almost have to wear all of those appliances and then wear them in a sleep lab and kind of see.
Oh, I see.
And I don't know if anybody has been willing to do that. But Apple watches, Garmin watches, Whoop bands, Fitbits. I mean, it seems like they all. I think it's kind of like the blood pressure monitors we have in the office. You're not gonna make a diagnosis, but I think they're good enough that they tell you, there's a problem.
Interesting.
And so I think whatever you use is better than nothing.
So when you were using on yourself, what did you notice? Longer deep sleep?
I noticed that it comes down to, again, we talk about sleep and, I got 7 hours or I got 8 hours.
Yes.
I go, if you talk about eating healthy, you don't say, I ate 4 plates of food yesterday. You're like, well, what was on them? It's the same thing about sleep. It's like, okay, was the quality sleep? So I found that sometimes, even if I only got maybe 5 hours of sleep, if I got good REM and deep sleep, I felt awesome. But if I didn't wear my appliance and I would get 7 or 8 hours, and I would feel horrible going, I don't feel like I slept well. So it really does come. And that's why I like my appliance, because sometimes we don't always in modern society get as the length of sleep that we should. And if I can wear that appliance and at least in the time I do spend in bed, get good quality, that's a huge benefit right there.
And then it's interesting because it's upper maxillary appliance, because as far as I remember, what I learned before, it mostly was lower, right? To kind of push your jaw forward, but then it messes up your TMJ. There's some disturbances. So it's very interesting.
Well, that was the interesting thing. Everything was always about the mandible.
Always mandible,
And so it was really interesting when I learned about this appliance and I read the book Breath by James Nestor. I found out it's all about the maxilla. It's the maxilla that's underdeveloped. And, think of the maxilla as the shoe and your lower jaw as the foot. Well, what happens if you try to put your foot in a shoe that's too small? Your heel is sticking out the back. Well, that's our tongues being pushed into the back of the airway. So when you grow that maxilla and you do get, because it does have an expansion screw and we're seeing the growth. Now, the interesting thing about the expansion screw on the Homeo block is that patients turn that key to keep up with changes that have already been created. It's not like in children where you're turning the key and you're pushing. Yeah. They're turning the key and then it should just pop right back in. And after usually 9 to 12 months, they'll turn the key and when they put it in, go, ooh, that fits tight. And then we say, back it off. We're not forcing anything.
So does it tilt your teeth out? No.
It does something. Even though the expansion screw looks like it's linear, it's probably doing something like this. It's an orthopedic appliance. It's not moving the teeth at all. It's only simulating the hard food in our diet. So that's what it's replacing. And certainly chewing on beef jerky wouldn't move teeth out of the bone.
So it sounds like it's not orthopedic. So from orthopedic point of view, what does it do to the bone?
It's probably causing some tipping of the palatal bones.
Okay.
It's just like mouth breathers get that vaulted palate, you're kind of moving things in the opposite direction. So when you do that, you're creating more nasal volume because the roof of the mouth is the floor of the nose.
Yes.
And the tongue is not sitting up in the space anymore. And as you're creating that width, you're also creating more tongue space.
Okay.
And then it allows, like I noticed, orthodontists messed me up. They had crowding. They pulled 4 bicuspids, and I had this really deep bite. Well, when I wore the Homeo block and then I followed up with some clear liners, I realized on my bite actually went to here. So it allowed my jaw to come down and forward. So now I would have a big open bite where if I bit the way I wanted to. So now I'm going to have my back teeth built up to that bite to see how I tolerate that. But I'm gonna probably get my bite back to where it should be just by allowing that jaw to come down and forward.
So jaw comes down and forward in TMJ itself. Does it have any effect on TMJ?
It does.
It does.
It's very. There's a lot of, obviously TMJ is another one of those subjects where there's a lot of different reasons why people have TMJ issues. But it's interesting that when people are doing that clenching and grinding to keep their airways open, the forces they're putting on their teeth are 4 to 5 times what you do while you're awake.
Oh wow!
There was a little device called the Gem Pro, and I did this at actually the seminar where I learned about the. Oh no, wasn't it the home ear block? It was the previous appliance that I was working with. But you put it in between your teeth and you sleep with it, and it measures the biting forces. The last thing you do before you go to bed is bite down as hard as you can. The forces in your sleep 4 to 5 times when you do your maximum biting when you're awake. And when I saw that, I go, well, that explains why patients were breaking some of the things where I think it's impossible for you to break this. Well, when you see the forces people put on their teeth, well, what do you think that does to their joints?
Destroying it.
Yeah, and they're grinding their teeth away. So that's why we see so many of those signs and symptoms in the mouth. Sometimes look at some, especially women, that you talk to them and they say, I've always taken good care of my teeth. And you look and they have a couple of root canals and a missing tooth and 3 or 4 crowns. Well, why are your teeth in that shape if you've always taken care of them? Well, when you think about, and they say, yeah, I've been clenching and grinding since I've been a kid. Now you go, okay, that makes perfect sense that when you're putting those types of forces on your teeth every night, I mean, teeth are amazing little structures, you know.
Very
that.
strong, yeah,
I mean,
stronger than bone.
We can chew on them for 80 years,
yeah,
but not if you're chewing on them at 4 to 5 times what they were designed to
hold. One question I always have in my head when I look at the kid, for example, or teenagers, sometimes you see occlusal wear, significant occlusal wear, but also there's a possibility that they have gastroesophageal reflux, right?
Yeah, that's total airway
and they
issue.
look completely like similar. So to tell the difference.
Well, the GERD is also related.
You think it's
related.
You
create that negative pressure with some of these airway problems. So GERD can actually be related. It's again, what's first, the chicken or the egg?
Yes.
Airway issues can create this reflux, and then of course you're also doing the clenching and grinding, and now you have this high acid levels, and they can destroy their teeth very quickly.
Yes, and you have full mouth of decay right there and then.
Yeah, throw in a little mouth breathing and a little candy before bedtime.
We see it all. Definitely. Yeah, it's very interesting to observe because it's very hard to see a difference between actually acid and grinding. I thought about that. It's probably interrelated somehow.
Yeah.
You mentioned in the beginning that's bedwetting, right? It's a big problem for little kids. Mom is going through potty training and poor guy or girl could not.
Well, it's an arousal mechanism to keep themselves breathing. Yeah. Bedwetting is a total airway related issue.
Totally airway related issue.
Yes.
Tossing and turning, unrested, like waking up and so on.
Whenever the body is doing anything, my first question isn't like what's happening. My question is why, because our bodies are intelligent. Everything it does for a reason. And so whenever the body's doing something, I always want to know why is it doing that? Because there's always, I consider our bodies to be intelligent and to not just do things because they're our body's bored. It's, our bodies are, survival mechanisms. So they're, it's trying to figure out how to keep us alive at all times. And why is it grinding away the hardest substance in our body? It's willing to sacrifice that tooth structure to keep us breathing.
To keep us alive. Yeah. So you have a special protocol, right? How you technically approach different type of appliances is one of them. What else is in that spectrum?
So we use in conjunction with the appliance. Like I said, to me, the appliance is the low-hanging fruit. I feel anybody on the spectrum can benefit from that because we're all somewhat deficient. We're all not perfect breathers, and most of us aren't full-blown apnea patients. So it's nice to have an appliance that anybody could benefit from and doesn't need a diagnosis of sleep apnea for. We're also using a procedure called night lays, which is dual wavelength laser that helps tone and tighten tissues. And there's a new protocol called the C3 protocol that where we're treating the floor of the mouth, and that helps move the genioglossus muscle forward. We treat the soft palate, and we treat the top of the tongue. We can actually shrink the size of the tongue.
So the CO2 laser on a low length?
It's not. I'm not a fan of the CO2 laser, except for it's a very good for doing things like tongue ties. It's a very good cutting laser. This is an ND-YAG and erbium YAG. And so the ND-YAG is kind of warms the tissue, and we heat the tissue. For example, the frenum, the tongue ties, I heat that tissue, and we try to get it to about 42 degrees centigrade, and I try to do a manual stretch. We can do some, because there's hyaluronic acid that's released in the fascia at that temperature. And you're also destroying adipose tissue at that temperature. And then the erbium is almost like microchanneling. It's like doing cool sculpt on the tongue. But you create these microchannels, and then you get neocollagenesis, where you get collagen kind of forming and tightening around that. So you get lifting of the soft palate, and you get tight and more, because it's all about collapsibility.
That's a very interesting approach.
Yeah. And then I just about a year ago switched from the Invisalign and SureSmile to a program called Pro Monitoring, which is also known by the name. It was Candid Pro, and then there's a company that Glidewell Dental that they called Pro Monitoring. That protocol was developed by an Airway dentist, and who did 30-some thousand cases of Invisalign as both as a mentor and a teaching type environment. And he didn't like the fact that even Invisalign with doing IPR is still I should mention what that is, interproximal reduction.
Yes.
When
it's
we have crowded teeth, instead of thinning and
Slicing.
slenderizing the teeth, they're all about let's move and improve the arch form. So they're all about properly tipping the teeth and moving everything out to get that proper arch form. And when you do the treatment plan with them, you can do a standard treatment plan or an Airway treatment plan.
What's the difference between standard and Airway?
They are a little bit more aggressive with widening
Expansion.
that arch form and creating more space. So all three of those companies separately, the HomeoBlock, the Fotona laser, the Pro Monitoring, they all kind of claim to treat sleep apnea separately. So what I've kind of developed is my own protocol depending on what's going on with patients. I usually start with the HomeoBlock, and then depending on what's going on, I will go ahead and say, you can benefit from the laser. And then once we're done with the treatment with the HomeoBlock, once they get to the point where they're turning that screw and there's no more changes, then we do a reevaluation to see, are those molars tipped in? Can we benefit from just tipping those out or creating that proper arch form? Generally, the bite stays really good with the HomeoBlock because we're not moving any teeth, but sometimes we still want to get that nice broad smile that gives a nice appearance, but it also is beneficial for breathing and more tongue space.
And success rate? What is success rate? Do you do sleep studies afterwards?
I would say we're probably up around 90% of patients once they start on the program. The nice thing is patients love the appliance.
That's good.
It's comfortable. They only have to wear it at night, so they can keep it in their nightstand, and it's an easy habit to get into. And once they start on the program, they love it and they stay on it. And probably 90% of the patients come back and say, this is helping me tremendously, and it's made a huge impact on my health. And a lot of our patients in a holistic practice, they've already made lifestyle changes. They've already made all these changes, and they're frustrated because they're going, wait a minute, I'm already doing the nutrition. I'm trying to do all these things.
Okay.
Why am I still not feeling as good as I think I should? So then when you add, I call this appliance the kind of the missing piece of the puzzle. When you calm their autonomic nervous system down at night and you get them breathing and sleeping better, now they really thrive.
Interesting. So technically it's kind of the group of population, people you see, they're already into healthy lifestyle.
Yeah.
So the modification on the other side is not as significant. So it's just the Airway, like a last block. What do you think about CPAP machine? Because traditional approach is CPAP. What do you think?
It's a rescue remedy. It obviously helps keep some patients alive, but it's a horrible long-term solution for a couple of reasons. Number one, you're just forcing air down into the lungs. You're not, when you don't have that proper nasal breathing, you're not warming and humidifying the air. You're not filtering the air. You're not producing nitric oxide. That having that mask on with a strap, they've shown that you're actually moving the maxilla back into the airway. So it's doing the complete opposite of what you want. And of course, it's very disruptive to people. I've never seen anybody have a sleep study. Their AHI may go down, but their sleep quality is really poor. So they're not getting good restorative sleep when they're on the CPAP.
Okay, so they're getting air, but not a good sleep.
Yes. And so they're showing even now that the number of strokes and heart attacks, that CPAP really isn't having a major impact on reducing those.
Wow.
Yeah.
What about this new appliance? I think it's Inspire. Did you hear about that?
Yeah.
The one which stimulates higher implantation. Yeah. I have a friend who have it. I'm just curious.
It's a pretty drastic
procedure. Yeah.
And I don't think once you have it implanted, they say like trying to remove it is almost impossible.
Oh wow.
It obviously doesn't resonate with people. I was talking to someone, they said they've done over 400,000 Inspire consultations, but only done about 8,000 procedures. Wow. So that kind of shows you it's a very, very small percentage of people.
I know one person who has this appliance, and his feedback was that in the middle of the night, his tongue goes like whoop, and it wakes him up. So I was thinking about the quality of sleep in this case, probably not the best, because you have mobility of tongue. So when you stop breathing, principle is right, it stimulates the tongue and kind of moves forward, right?
Right, exactly. Yeah. It's just it's like a little garage door opener size implant here, and then the wire runs up into the genioglossus muscle, and
it's a major surgery.
It is. Yeah.
And it just fires to stimulate the tongue to move.
Yeah, I think there's a sensor that detects when it's needed. But I was actually doing a lecture with an ENT specialist, and he brought a patient in, and he was talking about it. And he said, one time I left the house and I forgot to turn it off, and all of a sudden I'm driving and my tongue starts doing this crazy stuff. So
wow.
and I'm not anti, to me, all of the procedures, including CPAP, mandibular advancement, all those things, they're all tools in our toolbox.
Yes.
And I always feel that let's start with the thing where we signal our body and let our body do what it's capable of first. And then you can always go to plan B and C and D, MARP-B and other type of things. Those are all tools, but they're not the first tool I want to go to. The first tool I want to go to is how can we stimulate your body to do what it was meant to do in the first place?
What do you think about Murphy appliance?
Again, it's a tool. There's some patients that, depending on how they respond to the oral appliances and whether they're compliant.
Because I think they can do it until like 30 something, right? 37, because it's TADS, right? TADS implants it, and the appliance, same principle as RP.
Yeah. But a lot of that, we're seeing patients into their 70s and 80s that are taking that key and turning it and getting 3, 4, 5 millimeters of expansion on the homeoblock appliance. And so that's something that you can do at almost any stage in your life.
Very interesting. So do you think it's just rotating the maxillary plates, right? It's not like actually opening the suture itself.
No,
right?
no.
Not the palatal suture.
That
it's
suture
fused
is
and
long,
done.
close, and that's why I don't like calling it an expansion screw, because especially when you talk to dentists, they kind of like, no, you can't. It's I know. I go, it's really you're stimulating remodeling, and then the expansion screw is just to keep up with the changes that are happening. And it's interesting because some patients, they can turn that expansion screw and the appliance fits really well for a long time. Other people, the way their body remodels, they turn a key a couple times and you're like, oh my gosh, this appliance doesn't fit at all because of the way the bones are changing. So it's really interesting how the body can respond.
So what do, I'm curious, chiropractic care think about this type of appliance?
Well, the problem with chiropractors is that a lot of times they're treating patients with forward head postures. So a forward head posture, or I call it the CPR position, where patients kind of tip their head back, is a position where patients create a more stable airway. So if the patient goes into the chiropractor because they have neck and shoulder pain, and the chiropractor moves the head back to that position, guess where the head's going to go once they walk out that front door if the body says, I breathe better here? They're never going to be able to fix that problem until the airway is fixed. Now, that being said, chiropractic working in conjunction with this is really powerful. There's actually a group of chiropractors and physical therapists called PRI, Postural Restoration Institute, that by proper breathing and mobilizing the rib cage can do really some amazing things, but you still have to treat ultimately that root cause.
Underlying condition, why
but
airway is
when
so
you
bad.
work together, it's very, very powerful.
Interesting.
Yeah.
So it seems like it has to be multi-specialty collaboration.
You know what? It
from
really
day one.
is. I mean, we work with allergists, we work with ENTs, we work with, myofunctional therapists. You can't be, it's not just, I tell my patients, I said, this homeo block is part of a protocol. I go, I wish this was the magic appliance. I could just say, here you go, you put this in and all your problems will go away. And you do have to unravel a lot of problems and even look at things like, so many people even self-sabotage. They're telling me, I'm having 3 or 4 glasses of wine and I'm on my iPad till 1 o'clock in the morning.
Oh yeah.
My favorite joke is
your sleep is gone.
My favorite joke is where the guy goes, I would do anything to get 8 hours of sleep. And the other guy goes, well, how about going to bed 8 hours before you have to wake up? He goes, yeah, no, I won't do that.
Oh.
But it tells us that sometimes people are like, okay, you're complaining about your sleep, but you're not doing anything to help yourself. So, there's still human nature that we're fighting sometimes with airway
absolutely.
and habits that we have to correct.
What about allergists?
Yeah, that's huge.
So that's huge.
We send a lot of
Phoenix.
that's, and that's the big thing I look at on the cone beam. And before we send them to an ENT to do turbinate reductions, it's like, well, let's find out why are your turbinates enlarged? Why are adenoids enlarged? Let's find out. And we're finding out there's a lot of foods, even more than environmental, it's foods that people are allergic to. It used to be gluten and dairy. Now people come back, they're like, oh my God, I found out I was allergic to pineapple.
Oh, wow.
So,
so you actually do work with allergists as well, and sometimes even with ENT.
Yes,
right?
We work with all of those people.
So you do find, for example, if there is a bigger issue, you can see, right, on cephalometric, you can see adenoid, right? If adenoid is enlarged. And then at this point, we if we're removing it, we're still working with appliance. Would it fix itself if we remove adenoid, for example?
You know what? I mean, those are lymphatic and tissues. I mean, there's a reason why they're enlarged. So let's find out what's going on and try that first. And if it doesn't work, you can always go to an ENT and when in doubt, slice it out approach.
Yeah, because I mean, my understanding of lymphatic tissue, at a certain point, like we reach that 7, 8, it kind of start to shrink. So when we have an adult with enlarged adenoid tonsils, that has to be something else.
There's something going on
involved. Yeah. And then to fix that, you have to find the root cause.
Right. So that's always my goal. And for some people it works, for some people it doesn't. And then for those, you can always say, well, let's see what else we can do. But I would always prefer people not to have a surgery, a surgical procedure if there's something we can do that's less invasive.
Yeah. So I always ask my guests, tell me about your favorite case, which kind of dear to your heart, that you changed somebody's life and you remember so clearly.
Well, I just had a patient. He was a pilot. He flew for United Arab Emirates, the big huge Airbuses. And during COVID, he got COVID, and apparently they don't have the same HR departments in some of these overseas companies, and they fired him because he got COVID. They let him go, and he now is flying for Spirit Airlines here in the States, and he developed sleep apnea, and he couldn't wear his the CPAP, and they basically said you're going to lose your job. And so he had heard about me from another patient. He actually lives in Las Vegas.
Oh wow!
And he came in. We started him on the homeo block, and we did the nightlace procedure. We did a lot of testing and more sleep studies. And after about 6 months, we retested him, and he was almost normal. So I was able to write a letter. I showed them the before studies, the after, what we did, and I sent a letter to the FAA, and they cleared him. They said, "Here, you're going to fly for the next 2 years." And he always writes me letters saying, "Hey, thank you for saving my job." He's this fisherman. He goes up to Alaska, and he'll send me and my Airway assistant salmon from Alaska. He's like, "I'm just so happy." He goes, "As long as you keep me, flying, I'll keep sending you salmon."
That's good.
And so, I mean, you think about like saving someone's career like that is, and there's actually another pilot, this very, very similar situation. So it's, and there's so many stories, people telling me that they're able to share the same bedroom with their spouses again.
Yes, I can tell you so many stories about that, because we deal with pregnant mothers, a lot of with young moms with multiple children, and that's a big part of it. Yeah. So
this is definitely, I mean, I have to say, I told you I've been, doing dentistry for 40 years, and being a CEREC doctor and being at the chair is is tough on your body. So
it is.
To kind of have this final stage in my career where it's very, I love the fact that I've got, people who can kind of gather all the information, and I just kind of get to talk to patients and develop the treatment plans. But to be able to do something as kind of in the later stages of my career that's this rewarding and this life-changing for people has really been,
that's amazing.
I'm very grateful for how my career has gone, and because to be able to do this now. You
can actually change people's lives. Yeah, you can save lives. Yes. Because if you cannot breathe, you might have a heart attack early.
And I mean, that's why we go into the holistic and integrative, is like we want to help people's health. But those things, when you take out amalgams or pull an infected root canal, it still takes time. They have to detox, and it takes a while before they feel better. To all of a sudden do something where they come back in 2 weeks and say, "I feel like I have my life back."
That's amazing.
Really,
So at this point, you don't practice clinical dentistry, do you?
I haven't drilled in about 3.5 years now.
Wow. Yeah. So it's mostly Airway. That's very interesting. That's impressive.
Yeah.
It's a whole different field. Yeah. I love that our specialty in general is like evolving. Because I always felt that initially that dentistry kind of a separate corner in this whole medical field. But then your mouth, your airways.
We are really, that's what Weston A. Price kind of taught me, is that health starts in the mouth. And Dr. Felix Liao, who wrote the book 6 Foot Tiger, 3 Foot Cage, was one of my mentors. And he says, our lungs are to us what roots are to the plant. And like, these are the roots of our health. And to be able to have it, we really are physicians who specialize in the oral cavity. And I always say, I kind of jokingly say, I want to start making video. How they always joke about, "Oh, you're a doctor. Oh, you're just a dentist. You're not a real doctor."
Yes.
It's like, well, I really feel like dentists, we really sell ourselves short. We're so mechanically trained, yet the area we're working in, we really have more of an effect on patients' health than any doctor almost out there.
For sure.
And we get to see our patients a couple times a year. We get to communicate with them. We have so much closer connection to our patients than most doctors ever can. Because we build long-term relationships. How many doctors get to do that?
Yeah, lifelong sometimes, because you see, like I see some kids who I see as a newborn for tongue ties and lip ties release, and then I see them at the age of 18 graduating high school. On this positive note, what do you think we didn't cover in this podcast?
I think you did a really good job of covering most of it. I really, just kind of like where we ended up, that seeing the right dentist, because I think dentistry is one of those professions that can also do a lot of harm. And I think we have, by putting, I feel like some of the mercury restoration, those mercury releasing restorations, and even some of the other metals, not being aware that root canals can be problematic. I'm not a believer that all root canals are bad, like some holistic dentists are, but certainly not recognizing that some root canals can be very toxic. So dentistry can do a lot of harm, but it can also, it's a big spectrum. We can also have more of a positive impact on our patients' health than almost anything out there.
Of course. Especially, I like that in my lifetime, I already see mercury fillings kind of phasing out, and I think there's such a big awareness of it. So, when I opened my first practice, I didn't even have equipment to place amalgams.
Oh, really?
I
Nice.
don't have equipment to place amalgams because you have to have a special filtration system. And I don't see it in kids. Once in a while, we'll get a kid from different state, usually. For some reason from California, because I always thought California is more organic oriented or naturopathic oriented, but we would see with amalgam, but it's very rare when we see that. In root canals, I think root canals, if it's properly done, I actually had an endodontist on my podcast, and he was telling me how evolving that specialty is.
Like, we use it's not like, it's similar to the gentle way, but you're using the laser pulses to you're cleaning, doing a much better job cleaning out, and especially if you use things like ozonated water, which is much more powerful than the chlorinated products that they're using.
Talking about that, when I was growing up, I have interesting fact. Part of the city where I was growing up had actually, instead of chlorinated water, it was ozonated water.
Oh.
So they use ozone to disinfect the water supplies. That was very interesting. And I thought that it's actually widespread.
They did that, I think, in Los Angeles. They used an ozonating. I don't know if they did it for the whole city, but that's, a lot of, obviously, a lot of that technology came from Germany and Eastern Europe. There's a lot of the ozone is I could spend a whole, I'm actually the chairman of the ozone committee for the International Academy of Oral Medicine and Toxicology. So I've been doing ozone in my practice since about 20 years now.
Oh, wow.
Yeah, we use it to disinfect our water lines. We inject it around, sometimes people have a root canal tooth and they're like, hey, I've heard bad things about it. Should I get it out? And if we look at it and evaluate it and say, well, I think pulling this tooth would create more of a problem than I think it's creating, but let's infuse the area around this tooth with ozonated oxygen. And it's a good way to kind of mitigate and, because, let's face it, disease is always the bugs against the immune system. So if we can reduce the number of bugs and boost your immune system, then at least we're doing something good and we're not creating a problem by pulling a tooth that may or may not have a impact on your health.
Yeah, especially if it's like, it's not a live tooth, but at least it's not infected tooth.
Right.
And I think no matter what, it's better than some kind of artificial implant, no matter what. Because you think about implants that they are safe no matter what, but you hear a lot of stories about failing implants.
Well, and actually I used to do a lot of lectures for the IOMT on the titanium versus zirconia. So I've been doing the zirconia implants since about, I think, 2012. So we've only done the non-metallic implants in our practice for the last maybe 13, 14 years.
Yes.
And that technology, I think, is getting better and better.
Better and better, Thank you so much for coming to my studio. It was a pleasure to see you.
Thank you.
Very, very interesting conversation. And to my audience, guys, if you like our topics we cover, please comment below. Give us a lot of thumbs ups and share with your friends and family, because we're talking to different professions, different untraditional approach, and we'd like to see your feedback. Stay tuned.
Welcome to the Ask the Dentist podcast with Dr. Olga Dolghier, where your smile meets your overall health.